name is Samantha. I'm an ACE certified personal trainer, and I wanted to take some time just to run through chapter 6 with you, go over my notes, and pull out some things that I thought were most important. The front of this textbook looks like this, and it goes from page, in chapter 6 that is, goes from page 110 to 149, so it's a bit of a lengthy chapter. I'm going to pause the video intermittently so I don't ramble on and waste time, and just hitting the important points and moving on. Initially, I would like to go over some important definitions that I thought were a bit important out of this chapter. Empathy, that's the understanding of what another person is going through from their own perspective. The next one is asthma, and that's a chronic disorder characterized by inflammation of the airways. Now, asthma can be genetic, but it can also be a response to environmental triggers such as allergens, viral infections, exercise, cold weather, and stress. So that's something you would want to keep in mind if you had someone with a history of asthma. You may not want to take them outside when it's super hot and the pollen is high. Next one is coronary artery disease, or CAD. This is the most major cardiovascular disease, and it's a result of the heart's arteries narrowing, and we'll talk more about that and understand why they narrow. Next is high density lipoprotein, or HDL, and the next one is low density lipoprotein, or LDL. So the way that I remember HDL and LDL, I remember that HDL is the happy ones, and you want those to be high. The LDL are the lousy ones, and you want those to be low. But just to break it down, I kind of give you a definition of what HDL and LDLs are. So HDL is a lipoprotein that carries the excess cholesterol from the arteries to the liver, and it is your good cholesterol. You really don't need to know that part about what it takes it from the arteries to the liver. Just know that this is a good one. Your LDL carries excess cholesterol and triglycerides from both the liver and small intestines to the body's other tissues, and it is your bad cholesterol. And this one, if you have a high number of it can lead to, atherosclerosis, or narrowing of the arteries. Next definition is angina, or chest pain. It's commonly seen in people with coronary artery disease. It's characterized by chest pain, tightness, or radiating pain from the chest caused by a lack of blood flow to the heart. Next definition is ischemia. This is defined as a decrease in how much blood is supplied to an organ or tissue or other body part. The cause of ischemia is either blocking or constriction of blood vessels. If this occurs in the brain, it's also known as an ischemic stroke. Moving on, edema is your next definition, and that simply is just the medical term for swelling. Any swelling that results from fluid building up in the body. And it'll kind of be related to coronary artery disease. And these people can also have congestive heart failure, or CHF. I see that typically. Their ankles and feet will swell. But that's not super important for this. Let's talk about tachycardia, or fast heart rate. It's a heart rate that's elevated past 100 beats per minute. At the person's baseline, so like their resting heart rate, or if you're exercising, it's going to be high. But if you're sitting down and you're sitting still, you're not moving. If it's more than 100, you might want to look into some things like, are they dehydrated? And I would really want to know what their baseline resting heart rate is. But moving on, claudication. It's a pain in the calves that's similar to having cramps. It's caused by poor circulation to the leg muscles, and it's often associated with peripheral vascular disease, or PVD. That's the old people. Well, I say old, anyone can have it, I guess, but they have the cold hands and feet. They're freezing all the time because they have decreased blood flow, and they're just cold. Let's see, syncope. Just think of passing out. An unconscious It's a state of unconsciousness that occurs when a person passes out, falls on the floor, or they don't have to fall on the floor. But it's due to a lack of oxygen received by the brain. The more common name is just simply fainting. Perfusion. This is the passing of fluids through any tissue. It's best shown through the passage of blood from blood vessels to an organ, tissue, or muscle in the body. Blood perfuses through the vessels. Now we'll move away from the scientific stuff, body function stuff, and we'll move over to some legal terms. Liability. This is simply a legal obligation. Negligence. Any case of professional failing to perform up to the guidelines and rules. And that's all we're going to say about that for now. We're going to touch on this more in detail later. Chronic. Chronic is any medical condition or any condition that is present over a long period of time. I think they used to say anything that's lasting more than 3 months is considered chronic, and is the opposite of acute. So acute is a rapid onset of a condition. It's very short, but it could be severe, and it's the opposite of chronic. So chronic, long-term. Acute, it's just rapidly happening, a rapid onset. Back into more scientific stuff. Atherosclerosis, this is a fatty material that builds up on the inner wall of the arteries. It causes the arteries to thicken, harden, and lose their elasticity, and can lead to atherosclerotic disease. Say that fast 3 times. But anyways, when we talked about the HDL and the LDLs, so the LDL plays a huge part into this. It'll narrow the passageways. So like if this is an artery and this plaque is building up here, well, that only gives me that much room for blood to flow versus that much room, which would be much better, you know, if that helps put it into perspective. Let's talk about a stroke. It's a sudden and very serious blockage of blood flow to the brain. A cerebrovascular accident is actually what it's called in the medical field, CVA. But know that blood is not being circulated to the brain. It's usually due to a clot in the way that has blocked the passage. So here's my artery, and this thing has completely blocked it, so no blood is getting past here. Moving on, sprains. A sprain is a twist in a joint that is traumatic and results in stretching or tearing of connective tissues used to stabilize that joint. The most common tissues involved are ligaments and joint capsules. Many times there are some accompanying discoloration, swelling, or pain. So swelling, remember, we also call edema. All right, strains. A strain is a stretch, tear, or rip in the muscle or another tissue like the fascia or the muscle tendon. You think about that when, you know, thinking back in the past if you ever sprain or strain your ankle or knee or whatnot. Talking about, moving on, overuse injury. This is any injury caused by an activity that places a lot of stress on one specific area of the body over a long period of time. People often wear down joints like knees and elbows. And this is common in, this is just personal stuff I want to tell you. This is common in obese, morbidly obese individuals. They'll blow out their knees and their ankles because the human skeleton is not made to carry 400, 500, 600, 700 pounds, you know. So just to put that into perspective when you think about overuse. All right, let's move on. Diuretics. It's a medication or drug that causes an increase in the urine production and also sodium excretion. So it makes them pee extra. But it can affect their sodium level, which can turn out to be a big deal but we won't think too deep in that right now. Next one is arrhythmias. It's an upset in the rhythm or rate of the heartbeat. Sometimes this may be a sign of a serious heart disease, but not always. Vasoconstriction. Smooth muscles that line the vessels contract and narrow the opening of the blood vessels. So the next one is vasodilation, and that's an increase in the diameter of the blood cells for increased blood flow to another part of the body. So I just want you to think about this. Have you ever been outside and it's really hot and you're sweating and you're working or whatnot, and you look down and your veins are just like ropes? They're huge because they vasodilated. And then, you know, thinking about being outside when it's freezing cold and you can't see your veins because they have constricted to help you hold in body heat. But if that helps to put that into perspective for you, so they shrink when it's cold, they vasoconstrict, like a snake squeezes around something, it constricts. And vasodilation, they open up and get bigger, like out in the heat, to help you get rid of excess heat in your body. Okay. An electrocardiogram, also known as an EKG or ECG, and this device records the electrical activity within the heart. Auscultation, this means just to listen. You're listening for internal sounds of the body, most often the heartbeat, using a stethoscope. All right, Korsakoff sounds. The 5 different sounds produced by blood pumping through the brachial artery. It's the blood pressure determined from these sounds. And we'll talk about that more. You don't have to know from my perspective in dealing with the ACE testing so much about that part, okay? All right, so I'm going to take a little break, and I'm going to throw together like some questions, and we'll answer them. Stay tuned. Okay, guys. I have some study questions that I thought would be helpful in this chapter, and some of these things you will see later. So, ACE likes to talk about communication and talking about respecting a person's like distance, and they'd like to talk about your body position and how that comes across, and showing that you have respect for the client. So in order for you to communicate effectively, what is the recommended distance, body position that you should take in respecting your client's personal distance? A lot of communication comes across non-verbally, whether we realize we're doing it or not. So if I'm standing around talking to you like this, no eye contact, my arms are crossed, meaning that I'm closed off. You know, that sort of thing. You don't want to talk to your client that way. They're going to get the vibe that you don't care about them. Communication comes from nonverbal messages. 2 important factors of communication are body positioning and posture. A trainer should face their clients square and maintain an ideal distance of about, 2 to 4 feet. Now, understand that in some cultures, this is considered offensive if you get too close to a person. For our posture, we should have a relaxed but well-balanced posture, slightly leaning toward the client, showing that you have interest in what they're saying. Leaning on anything or crossing your arms can show disinterest. All right, moving on. Probing. What is probing? That's important. It's a part of communication, that type of probing. It's an interviewing technique in which the trainer asks additional questions in order to gain more to gain more information on the client. By asking these questions, we are inviting the client to talk about themselves and also feel more comfortable in doing so. So it's like thinking about closed-ended questions versus open-end questions. You wouldn't say, hey, did you have a good weekend? Because it could be answered yes or no. You could say, hey, how was your weekend? What'd you do this weekend? So they'll open up and talk to you and tell you. Let me think. Reflecting. What is reflecting? It's an interviewing technique where you restate the feelings or expressions of the client by just kind of paraphrasing back to them what they said to you, and to make sure you've heard it correctly. So you could reflect back, they can go and tell you all their issues and whatnot. So you summarize it in a smaller sentence or volume of whatever time, whatnot. And you can say, oh, okay, so if I understand correctly, you're saying that you have issues with overeating, you don't have time to get to the gym, and you've had a history of problems with losing weight. And they'll say, yeah, and they'll know that you were listening to them. And it's just to verify that you understand what they're trying to tell you. PARQ. So PARQ is the Physical Activity Readiness Questionnaire, and ACE does like to harp on this, okay? It's a form to get simple medical and health information to determine the client's ability to exercise. Are they healthy enough to exercise? Even if someone is doing their own self-guided workouts at home, they still need to assess themselves. If they have congestive heart failure, coronary artery disease, they need to see their doctor first to be cleared. Their doctor may not want them doing cardio or lifting heavy, bearing down to lift heavy, whatnot. Just to use that as an example. But the PARQ is a quick and easy way to, it's quick and easy to administer, but sometimes it can lack details and that overlook many important health conditions. Okay, guys, so the next question that I have from things that I thought were super important from this chapter is listing the primary reasons we give a risk stratification. And you want to memorize the positive factors within table 6.1, and I'll show you that here in just a second. It's very important as personal trainers for us to go through all of the client's information, identify possible risk factors, and this will let the client know if they need to see their physician first to be cleared, and what risks they are, if they're at high or low risk. All right, so this table 6.1, in my book it's on page 116. There, I don't know if you can see that. Talks about, are you looking to change a specific behavior? Are you willing to make this behavior change a top priority? Have you tried to change this behavior before? And so on. Just kind of asking, and again, probing works effectively here. But we give risk stratifications in order to determine three of the following things: the presence or lack of known cardiovascular, pulmonary, or metabolic diseases. Now, cardiovascular is heart, so heart disease. Pulmonary would be lung disease. And then addressing any metabolic disorders. Do they have diabetes, kidney disease, adrenal issues, thyroid, whatnot? Number 2 of that question, we're looking for the presence of cardiovascular risk factors or heart risk factors. And we are also looking for the presence or lack of signs and symptoms that suggest heart disease, lung disease, or metabolic disease. So if they tell you that their feet and ankles swell, you might want to dig into that a little deeply, because we could be getting into some cardiovascular issues. Okay. So that table on 6.1, I hate to sit and just read that to you, but, I'm just going to hit some highlights. Positive risk factors. Age. Men greater than or equal to 45 years old is a +1. Women greater or equal to 55 years old gives you a +1. That's something you can't change. It is what it is. Family history. Do they have any heart disease, in their family history? Has someone died suddenly from a heart issue before they were 55 years old? You can move on and read into that in depth yourself. Are they a cigarette smoker? Do they have a sedentary lifestyle? Are they obese? Is their BMI greater than 30? And the waist girth greater than 40 inches? for men and greater than 35 inches for women. And we're going to talk about that more later. We'll get the waist to hip ratio later on. Hypertension is the medical term for high blood pressure. So their top number, I know they came out with some new data lately and changed it, but it used to be greater or equal to 140, and I believe that's dropped down to 130 now. And the bottom number, or the diastolic number, was 90, and I feel like that may have decreased to about 80 or so. I can't remember, but you'll have to look that up. You can find that within ACE. All you have to do is go into your ACE personal trainer module that they sent you and type in hypertensive guidelines, and it'll pull it right up for you. Next, dyslipidemia. Low density protein, that's your lousy ones, okay? The lousy ones you want to be low, and the happy ones you want to be high. Let's see, the LDL greater than or equal to 130, and your HDL less than 40. If the total serum cholesterol is available, if it's greater or equal to 200 or more, you know. So pre-diabetes, they would be checked with a fasting glucose, and if that's equal to 100 but less than 125, they're considered impaired glucose tolerant, or IGT, and they could be at risk for pre-diabetes. All right, let's move on. Let's see. Yeah, the next one's pretty huge. Staying within your scope of practice as a personal trainer. So it is highly recommended that personal trainers seek the advice of other professionals to assess cardiovascular risk factors in the health history section, the exercise history and attitude questionnaire, the medical release section, and testing forms section. We are not here to diagnose people. So we're not going to diagnose them with anything. We need to refer them back to their primary care provider to be assessed to determine if they have a condition or a disease. All right. Why do we have a client to sign an informed consent? And what is the importance of having them to sign the release of liability? Well, also known as an assumption of risk form, the informed consent is used to acknowledge to trainers that the client has been informed of specific risks that are associated with exercise or the activity being discussed. The informed consent does not provide legal immunity like a liability waiver. The liability waiver is used to release the personal trainer from being responsible for injuries that may occur while they're exercising. But none of these, can prevent you from being sued from negligence. Let's see, number 8 in my notes. What information should be included in the health history questionnaire? The health history questionnaire is important. It talks about, current and previous physical activity, clients' medications and supplements they may be taking, current and recent injuries and illnesses they may have had in the past, both chronic, remember, long-term, or more than 3 months, or acute, which is suddenly. You'll be assessing their surgeries and history of injuries, family medical history, lifestyle information. This includes nutrition, stress, work, sleep, and that sort of stuff. All right, so, this is huge. Medications that are known to decrease the resting heart rate and exercise heart rate. And I do recall seeing this on the big test. Okay, so medications that may reduce both resting heart rate and your exercising heart rate are beta blockers, antihypertensive or blood pressure medications, calcium channel blockers, or tranquilizers. Your results in exercising may not be accurate, especially if it pertains to heart rate training. if your client's taking one of those medications. And of course, if someone is taking a tranquilizer, it's not safe for them to be exercising or while they're under the influence of a tranquilizer, because you don't want them to fall or hit their head on some weights or whatnot. It's kind of a no-brainer. What is the difference between diastolic and systolic blood pressure? So your systolic blood pressure is the amount of pressure exerted by the blood on the blood vessel walls during the ventricular contraction. And it's your top number. And diastolic blood pressure is defined as the pressure in the arteries during the phase of relaxation, and that is your bottom number. We can get real deep and scientific in this, but pertaining to ACE, for this certification, I would just keep it there. I would just keep it as systolic is the top number, diastolic is the bottom number. And you do need to know how to check someone's blood pressure. But I don't recall seeing anything. Now, they'll ask you blood pressure numbers and what's at risk or pre-hypertensive, but I don't recall them asking you the method in which to check someone's blood pressure. All right. What is the ratings of perceived exertion? This one's big, RPE. So it subjectively measures a client's overall feelings and sensations during the stress of physical activity. It's up to the client and their sense of feeling of pain during exercise. So no one person's measurement may be the same as another. Now, the Borg scale is typically used for RPE, or ratings of perceived exertion. There are two available scale-wise. One goes from 6 to 20 and the other goes from 1 to 10. I like the one that goes from 1 to 10 just to keep it simple. In the 6 to 20 scale, the value corresponds to a heart rate. So if the client chooses RPE of 10, they would consider themselves to be working at about a heart rate of 100. If they choose 15, then you would often consider that they are working at about 150 beats per minute. The 1 to 10 scale is used more often and tends to be better, I'm sorry, I just lost my place, better a measure of exercise intensity. In this scale, the client chooses a number from 1 to 10 based on 0 being nothing at all and 10 being very strong and possibly maximal work for them. So if someone's choosing a 4, their work intensity would be somewhat strong, intermediate, level. There are many medications that would affect that heart rate. The typical ones that decrease the heart rate are all found, in the book it talks about beta blockers, calcium channel blockers, tranquilizers, hypertensive or high blood pressure medications. But it's not just limited to those. It could also be medications like antihistamines, antidepressants, alcohol, diet pills, caffeine, and nicotine. All right, I think that's all that I have for you. So the next chapter, in my opinion, is the most important chapter of the book. It's kind of difficult, and I would go ahead and be reading ahead on chapter 7. All right, thanks. See you next time.